Welcome to The Healthline, issues that shape our well-being. I am your host, Dr. Andrea Alt-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving complex healthcare system. In today's episode, we welcome Lauren Eklund, Assistant Vice President of Clinical Initiatives at Northwell's Katz Institute for Women's Health. As Assistant Vice President of Clinical Initiatives, Lauren leverages clinical and administrative partnerships to build clinical programs for women and connect women to care. With 20 years of nursing experience, Lauren is dually certified in medical surgical nursing and as a nurse executive. She obtained her undergraduate degree from Adelphi University and began her career at North Shore University Hospital, caring for the adult surgical oncology population. Lauren completed her master's in nursing leadership and administration, graduating summa cum laude from American Sentinel University, and later earned a certificate in clinical bioethics from Hofstra University. Lauren has been nominated twice for Northwell Health's President's Award and was the recipient of the Daisy Nurse Leader Award in 2022. Lauren is passionate about creating an environment of support and transparency, always seeking to learn and partner with others to foster exceptional patient outcomes. Lauren, it's my pleasure to welcome you to the Healthline.
So excited to be here today, Andrea. Thank you for having me.
We'd like to learn more about the Katz Institute for Women's Health. So why does Northwell have an institute that's squarely focused on women's health?
Of course, I have to reflect upon our vision and mission, right? So the vision is to redefine tomorrow's healthcare for women today. And our mission is that we are dedicated to improving the health of women across their lifespan, bridging the gap between wellness and personalized care delivery to advance women's health every day by providing expert, coordinated clinical care, educating the communities we serve, prevention and well-being, and supporting sex and gender-specific research. And I think it's important to reflect on the why, which we touch upon actually on the website as well, and something that I think people are not aware of, but it wasn't until 1993 that federal law required that women be included in research studies. Which is like mind-boggling, right? Because I don't know about you, but to me, 1993 doesn't feel like that long ago. Yeah. So what does that mean, right? When women aren't included in research studies, it means that mostly men were included in research studies. So if men are the default in research, they've been the default in medicine, leaving women understudied, undertreated, and misdiagnosed. And like our SVP, our fearless leader and executive director, Dr. Stacey Rosen, always says, who, by the way, is the president-elect of the American Heart Association. We're so proud of her.
Congratulations.
She's amazing. But as she always says, women are not little men. We're different down to the cellular level. So how do we make sure that we're listening, that women's needs or symptoms are not being dismissed or gaslit? Other considerations, so women utilize more healthcare services due to more frequent and complex needs than men, which translates to more doctors, more dollars spent. We're the majority of the U.S. population. So we make up nearly 50% of the workforce. We control over 60% of personal wealth, and women serve as the chief medical officer of their families. Mm-hmm. So they make about 80% of healthcare decisions in the U.S. Why is that? Because they're making decisions for themselves, their partners, their children, their parents. So by taking care of women, we're not only taking care of individuals, but their families and communities. Healthier women mean healthier families, healthier communities. We're in a unique position to have a broad impact because when we raise the health of women, we raise everyone.
I mean, it's really alarming that we were not included in research until the 1990s. So yes, that is pretty interesting and so thankful that we're now having such a strong focus on women's health.
Can I clarify something? So women were included, but it wasn't a federal mandate.
It's interesting that it wasn't federally mandated that women were not mandated to be included in research until the 1990s.
Right, so, and that's not to say women weren't included, but the majority were not.
On your website, and you mentioned this before, that you are looking at women from across the lifespan. So not just breasts and babies, but, looking at their breasts and looking at birthing, but also other aspects of women's health. Can you tell us more about what does the Northwell's Katz Institute for Women's Health, what programs do you offer? What services do you provide?
So we have a network of over 1,000 clinicians across more than 25 specialties who are dedicated to caring for women. We identify needs in the community, needs identified by our clinicians, by our team members, to start to build out these programs. So I'm considering our menopause and midlife health program. Again, let's think historically. So women suffered through menopause, and it was something that grandma didn't talk about, mom didn't talk about. It was part of life, and you were just expected to just live through it. We wanted to change that, right? Because there are so many symptoms that can happen during menopause, and we want to make sure that women feel cared for and that these needs are addressed. So with anything that we build, we always want to look at the foundation. So about 2 years ago, we took a look at who are our certified menopause clinicians across the Northwell footprint. So when you consider, this massive healthcare organization, 21 hospitals, over 900 outpatient facilities, we had only 6 certified menopause clinicians across the entire footprint. Clearly, we had an opportunity, and the Institute offered to support certification to interested OBGYN, internal medicine, family medicine doctors. We now have over 40 certified clinicians, with another 15 clinicians sitting for their certification actually this month. It's a live proctored exam offered by the Menopause Society. We are building a comprehensive multidisciplinary program, so we're looking at what other specialties need to get certified, what other clinicians should get involved, so that we're addressing the emotional, the physical, the social, and nutritional needs of women as they transition through their natural or surgically induced menopause, right? Some women, because of cancer treatment or other reasons, right, they end up having a surgery that's life-altering and it throws them into menopause, sometimes very prematurely. We targeted strategic recruitment to build the largest Menopause Society certified network across multiple disciplines. We bring these clinicians together in our Menopause Collaborative, led by Dr. Stephanie McNally, and we do case study review. We discuss CME programs designed for clinicians to keep them abreast of the latest information about menopause. We're developing standards of care so that no matter where you access a menopause certified clinician across Northwell, you'll receive that same level of care, of course, while having the ability to individualize care. We've forged partnerships with local and regional organizations to raise awareness and educate women in our communities, largely debunking prior findings, right, from a study in the 90s, early 2000s that shared that hormones cause breast cancer and stroke, which was later found that they had an entire, wrong population of women. They had the wrong range of age. And so that's still, though, in minds, right, and stays with people. And so we're trying hard to educate as best we can. Future state, we're in the planning phases of dedicated physical locations across Northwell's footprint. And then we're looking at future technological solutions, so access, navigation, to help continue to connect women to clinical services and educational resources, as always advancing sex-based science and research to understand symptoms and treatment options.
And actually, my understanding is that you opened up a new site in Rockville Center, right, that's focused on, I believe, pelvic health?
Yeah, that's our pelvic health center in Rockville Center that just opened a few months ago. That's one of the other programs that we've been working on, partnering with our lead on this, Dr. Danielle O'Shaughnessy, under the premise that women who present with a pelvic health concern can wait months to years before they have a diagnosis, right? So in the case of endometriosis, for example, they can wait up to 8 years before they get that diagnosis. That's too long.
And why is that?
They end up going from specialist to specialist, right? And we're not quite sure what's going on. When you say you have, let's say, pelvic pain, it could be coming from a number of different sources, right? So how do we make that better for women? We pull together specialists across 12 different specialties that impact pelvic health. So everything from OBGYN to colorectal surgery to gastroenterology to orthopedics, rheumatology, you name it. And then, of course, all the adjunct type specialties like behavioral health and nutrition that also impacts the way women feel and their health. And we ask these clinicians to weigh in on what are those symptoms, what are those questions we need to be asking women that would drive them to your specialty versus another. And so we ended up with this massive algorithm, right, for all these specialties that no busy clinician in any practice could ever utilize because it's too cumbersome. And that's how we landed on navigation. We have nurse practitioners who will navigate a patient, have that sensitive clinical conversation, hone in on where these symptoms are coming from with the goal of getting the patient to the right specialist the first time. They will circle back with the ordering clinician to say, hey, I had this conversation with your patient. This is what I found. I'm entering a referral for whatever it may be. They then follow up with that patient also after they've had that consultation and that initial appointment to make sure we've addressed all the needs. Is there anything additional? And if there is, we continue on from there. It's similar to like a concierge type service, again, with the goal of getting women to the right place the first time.
Nice. And then hopefully cutting down that time from 8 years to hopefully less than a year.
Absolutely.
They're getting the care that they need
Absolutely.
when they need it. And can you tell us more about the Women's Heart Health Program that you have?
As I shared earlier, right, our fearless
Exciting.
leader is a cardiologist herself, so Women's Heart has always been on the radar. And last year, we hired our very first system director of Women's Heart and director of cardiovascular medicine at the Katz Institute for Women's Health, Dr. Nisha Parikh. And she came to us with many years of experience and has been essential in the development of women's heart programming, from identifying who our women heart specialists are to identifying those clinicians who also practice subspecialties, such as cardio-obstetrics and cardio-oncology. She's been the driving force to ensure that women have access to cardiovascular care across our footprint.
Actually, one thing that you and I have discussed previously earlier this year was that connection between heart health and maternal health, especially when you're pregnant.
Whether women have a known congenital heart defect, sometimes these defects come to light when the body is under stress during pregnancy, right? And the blood volume is greatly increased. Sometimes you run into conditions like preeclampsia, and you can have a woman who seemingly, extremely healthy, no prior history, and then all of a sudden, right, she's got something going on with her heart. No matter the origin or the type of condition that does come about or need to be addressed, the Women's Health Heart Team can absolutely address.
Tell us more about your role at Katz. And I understand you have a clinical background, as we mentioned in your bio. So tell us more about the role that you play at Katz.
My role is to take an identified need or women's health gap, partner with our core team, which is small but mighty. There's about 25 of us. I'm the only nurse. I'm the only clinician other than Dr. Rosen, Dr. Vinkoff. I partner very closely with our medical director, Dr. Nina Vinkoff, and clinical specialists and administrators from across the organization and externally sometimes to build those connections and programming for women. So when you go back to the pelvic health example, for example, consider all the specialties that touch pelvic health, partnering with these specialists across all specialties and partnering with administrative leaders across the footprint, all of Long Island, Manhattan, Westchester, Staten Island, and now upstate New York and Connecticut. These partnerships are crucial. So it's a lot of collaboration and connectivity.
Full disclosure, you and I met through one of those collaborative efforts where myself belonging to an outside organization that does a lot of work in the community and wanting to do some programming on women's health, we formed that relationship and did a number of programs together over the past year focused on maternal health and heart health and also menopause and how it relates to metabolic disease syndrome. From what I know personally, Katz does a lot of community-facing work. And you have webinars and you have various types of collaborative events. Can you tell us more about those types of programs?
It's actually historically what Katz was all about. For like the first 10 years, it was a lot of community outreach, education, creating collateral pieces, education to share out at these events. We do have our women's health webinars. They're free. They're open to the community. They're accessible through our webpage and the Women's Circle subscription. They're monthly, sometimes bi-monthly, and they cover a wide range of women's health topics. So everything from pelvic floor physical therapy to cognitive behavioral therapy for menopause hot flashes to weight loss, questions about all these GLP-1s that are out there now, healthy habits in general. The topics really run the gamut. And there's so much out there, so much to learn. We leverage the expertise of our clinician members to inform and present whatever these topics are. So it's really an amazing resource.
Yes, very much so. And I personally have benefited from all the resources that you offered through Katz. And you have some exciting programs on the horizon. Can you tell us more about those programs?
Just a couple teasers and things that we're fleshing out right now. You know, we talked earlier about women being the chief medical officers of the family. We aim to reach them where they're at. Right? Mm-hmm. So we're looking at the fourth trimester, quote unquote. So you've had your baby. Where are you going to be with your baby? You're going to be at the pediatrician, right? So how do we reach these women at the pediatrician for their needs in addition to the needs of their children? We strive to ensure that programming reaches women at every age and stage. So whether you're an adolescent athlete needing some advice on optimizing nutrition and hydration, or you're the mom visiting the pediatrician with her newborn, or you're a woman going through natural or surgically induced menopause, or a mature woman who has bone density concerns, the Institute is here to support. So the fourth trimester clinic is something that's up and coming. Also our PCOS program, so polycystic ovarian syndrome, another complicated type of diagnosis. The prevalence is a lot higher than you would think. But again, these women go underdiagnosed, right? And sometimes don't always fit the mold that we think of when you consider polycystic ovarian syndrome. So we have to be able to look at this nuance. Again, a multidisciplinary approach, bringing in adolescent medicine to try and reach these young women earlier on in life rather than having them wait a number of years before they get this diagnosis. Reproductive endocrinology and infertility, right, when that comes into play, because these women tend to have some trouble with fertility, endocrinology, weight management, of course, OBGYN, and then support services such as nutrition.
And I think one thing that's amazing about Katz is that it really helps women who usually, like you said, they're the CEO of their family. They're taking care of their children's needs, their partner's needs. And oftentimes we leave our needs to the back burner. And so one thing I appreciate about Katz is that not only is it a one-stop shop, but you are bringing so much information and resources to the community. It just makes it a little bit easier for us to take care of ourselves. That's an amazing resource that you're providing, I think, to women in general.
Yeah, and we touched upon this earlier, right? We partner with so many community organizations. We were just yesterday at the Viscardi Center in Albertson, which is something very near and dear to Iris Katz. So Iris and Saul, of course, we're very fortunate to have their support and philanthropy to create the Institute. Right. We've targeted education for the special needs population. So we've held moms and daughters workshops to educate these young women. What should they expect at their first GYN visit? Their menstrual health, what's normal, what's not, their breast health, what's normal, what's not. And we've also partnered with their inclusive higher education program. They partner with Nassau Community College. We've helped to inform their curriculum. So teaching these young people how to manage their stress, how to get proper nutrition, proper body ergonomics with our STARS PT colleagues at Cohen's, no matter your level of ability, right? Whether you're wheelchair bound, able to walk some, not able to walk at all, there's something for everyone. So we make sure that we really tailor it to the needs of the special needs community. And then, of course, so many different other community organizations. So the National Coalition, right, of 100 Black women to bring in-person and virtual programming. We had an in-person women's heart health event here at Hofstra. And a virtual program about menopause and metabolic, where we brought in specialists from weight management, nutrition, endocrinology to talk through all considerations. It's something that the Institute's known for a long time and that we love to do.
And you're excellent at it. So thank you on behalf of my organization, the National Coalition of 100 Black Women Long Island chapter, for doing those programs with us. We're giving the audience a lot of information about the resources that Katz provide. How can people who are listening to today's podcast access those resources? How can they find out more information about Katz?
So we're everywhere. So you can connect with us on Facebook, LinkedIn, X, Instagram, at Katz Women's Health. You can join the Women's Circle. You can access from our webpage. If you simply, search Katz Institute for Women's Health, it will come up. It's northwell.edu/Katz Institute for Women's Health. There's a lot out there, so absolutely connect with us.
It's been a pleasure having you on the podcast today. today. Before I let you go, are there any final words that you'd like to share with our audience just about the importance of prioritizing women's health?
I think it's really important to continue the chain of education. Share the institute, share the access, the resources with all the women in your life who you love, because they'll all be a patient someday, and you want them to be armed with that knowledge. So that when they're faced with something, they're able to make smart decisions in partnership with their clinicians.
Thank you so much, Lauren, for coming on to the podcast today. The work that you are doing and Katz is doing is amazing. So thank you for all that you do for women's health and just keeping us all healthy and prosperous and living our best life. So thank you. I'd like to thank our audience for listening to today's episode of The Healthline, Issues That Shape Our Wellbeing. I would like to thank our studio engineer, John Mullen. I also like to thank WRHU Radio Hofstra for their help with the production of this podcast. Lastly, I would also like to thank Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Alt-Brutus, and thank you for listening. Have a great day.